Hello, good afternoon, and welcome. Wherever you're watching us from, I trust we are all doing well. My name is Clement Lokoma. Welcome to today's discussion. Remember, it is Menstrual Hygiene Day, and with me here, I have a couple of representatives. From my left, I can see we have a youth champion, we have a mentor, we have a representative from the Ministry of Health, and again here we have a students. I believe you're going to have a great discussions concerning the issue of menstrual hygiene. Maybe to kick us off, I'll give my panelists a chance to introduce themselves. I'll begin from my right. Yeah, I think you'll just tell us who you are, what is your name, if you're in school, which school are you representing, or rather, if you're a youth, what work are you doing, or rather, which work are you doing? I'll begin from my left, kindly.
Hello, I'm Emmanuel Kipto, representing youth as we are going to celebrate this day. Thank you.
My name is Miriam Chebet. I'm a mentor from a project called Holistic Action Project for Young Adolescents, and it is funded by DSW. Thank you.
Thank you so much.
By the name's Barak Hussein, and I'm a young adolescent champion from Kachilba Mix Primary School. And I am also a AAN member from this project called HAP, or Holistic Action Project for Young Adolescents. Thank you.
Good evening. I'm Ruata Philip. I represent the Ministry of Health, West Pokot County, under the WASH program, school WASH program. Thank you.
Yeah, thank you so much, my great panelists, for that introduction. I can see from my left we have a youth representative. Again, we have a mentor. We have a champion, or rather an adolescent champion on the issue of MHM. And again, we have a representative from the Ministry of Education, right? Yeah, in the West Pokot County government. Remember, basically, the main purpose of this day is to park the issue surrounding menstrual hygiene in our county. And to begin us off, I'm going to ask us some couple of questions that are going to revolve around. And per se, maybe let me start with Emmanuel Ngolepus, that is youth champion in West Pokot County. Maybe per se, Emmanuel Ngolepus, if I ask you today, what role are you playing in promoting menstrual hygiene as a youth champion? Maybe you can give us an overview of what you're doing, or rather your role in ensuring that our women and our girls, our sisters, menstruate with dignity. Maybe I'll go first with you.
Yeah, me, as in, I've been working under Declare's organization group as a youth champion, and we have been moving around, educating our youth, so now they should ensure there is no stigma in matters surrounding menstrual, and also educating our girls so now they can, as in when they are in that menstruation period, as in wakiwa katika hiyo wakati ya kuwa na hedhi, so tunawafunza, alafu pia kumekuwa na mipango kushirikiana pia na county government of West Pokot Ministry of Health. Kuna wenye wanatoka in vulnerable as in vulnerable places wamekuwa supplied na hizo sanitary pads to ensure that hata kama wako katika hiyo hali hawawezi kosa kwenda shule, alafu pia they can also associate with people, as in wasikuwe stigmatized na wakae kama watu ambao wametengwa.
So thank you so much for that, Mr. Emmanuel Ngolepus. I can see you're doing some great work concerning the issue of menstrual hygiene. I think first you say there is an issue of stigma. You're trying to reduce the stigma around the issue on MHM. Then again, the second thing you're trying to do, you're collaborating with the county government of West Pokot to ensure that our girls and women have access to menstrual products, or rather the pads. That is a good work you're doing. Thank you for that. And maybe secondly, I'll go to a gentleman sitting next to me. That is Barak, who is a student. Barak, if I'm asking you today, I know you're in a primary school, and I know it's not a boarding and it's a mixed school, right? Yeah, you as a student and as an adolescence champion, what role are you playing in ensuring there are women or rather our sisters, your sisters of whom you're studying with, have an accessible, or rather have a receptive environment on the issue of menstrual hygiene?
Thank you. As youths, we have been doing some media engagement. This is like we were talking about how girls can maintain that menstrual hygiene, like how to wear that sanitary pads and participating in public meetings so that to improve the that challenge that affect the child.
Yeah, thank you so much for that, Barak. I can see you guys are conducting media engagements. And again, you're saying you're supporting girls on the issue of on how to wear menstrual pads. Is it? If I'm asking, how many of you taught umefunza wangapi jinsi ya kuvaa pads in your area, or rather hii time ya campaign?
Okay, me as a youth, as a champion of young adolescent champion, I have a group of 40 pupils in school, and we have been teaching each and every of them how to maintain menstrual hygiene and other challenges. Thank
Yeah, thank you so much for that, Barak. I know you are one of a gentleman, man. I'm trying to imagine rather a boy, rather men involvement on the issue of MHM. I know many a times men and boys, we don't want to take part in this issue concerning menstrual hygiene. At times we are part of stigma, but I'm proud of you, Barak. Keep on doing what you're doing. Make sure girls have that dignity, or rather they have a receptive environment in ensuring they undergo their menses in a dignified way. Maybe if I go next, I think I'll go to your mentor before you leave. Yeah, so Miriam, I know you're a mentor, maybe in your area of jurisdiction. You work a lot with young people, perhaps adolescent girls. You come across women. What role are you playing in ensuring that in your area of jurisdiction, wamama na wasichana wako na environment nzuri ya kuundergo their menses?
Okay, personally, I am a mentor under a project called HAPA. That I've said is an holistic action project for young adolescents. What we do mainly is that we engage young adolescents in schools. These adolescents are between the age of 10 to 15, 16 years. Okay, what we do is we create awareness by making sure that they get the correct information about menstrual health management. We've been having issues of cultural norms and taboos. What we do mainly is to break those cultural norms and break the silence and make women know that menstruation is a normal thing and that they should embrace it. Secondly, in our clubs, that is HAPA clubs in school, we have both boys and girls. This is because we want to bring boys on board on issues of menstruation, because boys in our community, Okot community, boys and men are the key decision makers. So we saw that it was good to bring boys and boys and men in the board so that they can support these little girls, these vulnerable women during their menstruation session or period. Thank you.
Thank you so much for that, Miriam. And I've picked some interesting point from your discussion, the issue on the patriarchal nature of our society, in that men and boys are the one who make decision on behalf of our women and our girls. Maybe per se on the same issue on involving young boys on the issue of MHM. I'm trying to think, how hard is it, or rather how do you guys do it? Maybe you can give us how are they taking that information of being part of a group that is advocating for something that is rather not affecting them, per se, the other gender. Maybe.
Okay. Menstruation is a normal thing. But then people tend to shy off from speaking about it, yet it's a normal thing. Okay, boys, we have boys in our clubs and they are taking it good. For example, we have Barak as our peer educator. He's doing good. You know, what we focus, what we, in the past years, what has been happening is that no one has really embraced the boy child or the men or try to bring men on issues affecting girls. But currently what I'm seeing is that there is a positive change and boys are embracing it. There's no big deal about it. These boys, when we give them direction and guide them well, they will pick and do the right thing.
Thank you so much for that, Miriam. I can see the boys are taking the information with light, and they're willing to support their fellow sisters and even women in the society. That is a good thing. I think now let me move on to Ruata Philip. I know you are in charge, or rather, you're representing the West Pokot County Ministry of Health. Yeah, I know when you talk about MHM, all eyes are on the Ministry of Health. And I know you guys are the major people, or rather, you guys are the one who guys will be looking up to you. The question of which in this day it will be directed into you guys. So let me begin by asking you this. Maybe in your capacity, or rather in your capacity as a representative of the West Pokot County Ministry of Health, what role, or rather what role are you playing in ensuring that in our county, or rather the country at large, we have an environment that supports menstrual hygiene of our young women and adolescent girls?
Thank you, all our viewers. I would like to appreciate today's meeting. And starting from the theme of the day, the theme is action and investment in menstrual hygiene and health. So, from our point of view, the Ministry of Health, we are there as an epicenter. We bring on board all other partners like the Ministry of Education, partners, such that we have a day like this. We involve all partners, even the political class. I will want to say that previously we have been having such a meetings where we involve even the political, the women reps, the let's say the county first lady being gracing such occasions, and at times we bring on board school pupils where we gather in a certain school. We bring on board all the pupils and we inform them the importance of this. What we do is the stakeholders come on board and they give items to the girls, like what they need. They usually give, and they feel proud of the day. And we have continuous education on MHM, Menstrual Hygiene Day. We have school health clubs where we have the patrons. There are a lot of things the ladies they lack, and what we do as a health department, the requirement as per the school, we find a school having even less toilets to use in their school. So as a health department, we usually collaborate with the Ministry of Education and we inform them that this is a must. We have a standard. When a girl wants to help herself, if they have less number of toilets in the school, it's a challenge. So it's upon our department and the sister department, the Ministry of Education, to ensure that they have adequate, such that the girls will not have that fear. I think we have the scenario whereby when a girl is undergoing such a menstrual hygiene or menses, she end up staying at home because she lacks the required. So we are now advocating the entire community that it is upon a parent and even the stakeholders to ensure that the girls have a good environment for learning. That's what I can add. And for all, we're having such advocacy in our county. We have the local media houses, so we usually advocate weekly. So we have local radios, we usually go there and advocate the community. So when they hear, I'm sure they're passing the same information to the girls and the girls and the women in the county. So that's what we've done as far as health is concerned. And also we have some partners who are assisting these programs. So we'll also want to appreciate the partners for their good work in ensuring that the ladies and the girls and the young women are progressing well health-wise. Thank you.
Thank you so much for that, Mr. Ruata. I know you have given us so much insight on the role that the Ministry of Health is playing in ensuring that we have a receptive MHM environment that support our women in terms of undergoing the process they're undergoing. Maybe if I'll take back to you, before even take back to you, I think I'll ask a few questions that are still directed to you. I know you have mentioned something about the school health club. And for me, I understand that is one of the most sustainable way of ensuring information is being passed to our young girls who are in school. You have talked about the issue of ensuring that our schools have, or rather a supportive environment that will allow our girls in terms of having accessible toilets, in terms of having accessible water. And I'm glad you represent the WASH program in the county government. Perhaps if you can give us a deeper insight on how far, or rather how far can you rate the environment in our schools in terms of MHM? Do you have these facilities? Do you have accessible toilets that our adolescent girls who are in school can easily go and change their pads? After that, they have accessible water to wash their hand after it. Do you feel like, or rather, how far do you feel you have gone as a county?
I appreciate the work the schools have done in our county, but not all are adhering to the standards. I can rate as okay, let's say at 60%. Most of the schools are having. For instance, in a girls' school, we want at least 25 girls using one door of a toilet. So you find when you have more than 200 girls, meaning you need to have like over 10 doors of toilets. That will ease when they want to assist themselves. So, but due to presence of partners, I know they are doing good work, and they are there also to assist, plus the county government and the political class, what they are doing. So, generally, the work is going on well, and it requires continuous advocacy on our environment to become good for our girls and young women. So that's what we're advocating. And it is continuous through the support of the clubs in our school. All schools in our county are having formed and functional health clubs through the school health program. So we are partnering with the Ministry of Education and the partners. That's what is going on currently.
Yeah, thank you so much for that, Mr. Ruata. Yeah, and I know we have youth champion, Mr. Maza Emmanuel Ngolepus. I know you have heard what Mr. Ruata had said in terms of us as youth, or rather in terms of you, because I know one of your role as youth on issue of MHM is advocacy. I know there is a gap that Mr. Ruata has highlighted. He's saying that 60% of our institutions, or rather of our schools in West Pokot County, can support girls to undergo their menstruation freely, or rather with dignity. What about the 40%? So I think it's work that we need to do, you as a youth champion, and even you, Barak, as a adolescent champion. This is one of the gap that we need to address, per se, in collaboration with Mr. Ruata under the Ministry of Health and even the Ministry of Education. Yeah, maybe before I proceed, for all of you who are watching us from home, kindly you can drop in your comment. We'll sample a few of them after a short break. Maza, or rather Emmanuel, if I come back to you again, you have talked on the issue of ensuring there is no stigma on issue of MHM in the society, right? Yeah, so if I may ask you, apart from stigma, which other issue do you feel the society, which other MHM issue do you feel is still exists in the society?
As a young woman, having access to sexual and reproductive health and rights services is essential for me to achieve my potential. It supports me to lead a healthy life, address violence and power relations, participate in economic, social, and political life, and make decisions governing my own body freely. Thanks to having access to sexual and reproductive care, including a full package of youth-friendly sexual health services, family planning, and comprehensive sexuality education, young women like me can have access to decent work opportunities and fulfill our potential. Only then can we become change makers, promoting gender equality and driving forward sustainable growth. The realization of the sexual and reproductive rights of all people and eliminating gender-based violence is necessary to ensure we leave no one behind in the effort to realize economic justice. Share, like, and comment if you agree. Digital tools are an increasingly popular way for young people to access information and services, from education to healthcare. Mobile technology can be used for accessing comprehensive sexuality education, convenient and confidential health services, including sexual and reproductive health care and accurate information about sexual and reproductive health and rights, leading to better levels of education, healthy and safe relationships, empowerment, and general well-being. But almost half of the world's population remains offline, with women and girls less likely to have access to technology. In low and middle-income countries, only 54% of women now use mobile internet. Closing the digital gender divide by promoting policies centered on women's empowerment, including sexual and reproductive health and rights, is crucial to creating a digital transformation that leaves no one behind. Digital equality is essential to ensuring every young person's potential is fulfilled. Share, like, comment, and help us spread the message. Digital tools are an increasingly popular way for young people to access information and services, from education to healthcare. Mobile technology can be used for accessing comprehensive sexuality education, convenient and confidential health services, including sexual and reproductive health care and accurate information about sexual and reproductive health and rights, leading to better levels of education, healthy and safe relationships, empowerment, and general well-being. But almost half of the world's population remains offline, with women and girls less likely to have access to technology. In low and middle-income countries, only 54% of women now use mobile internet. Closing the digital gender divide by promoting policies centered on women's empowerment, including sexual and reproductive health. The climate crisis is one of the greatest challenges of our time. It threatens our planet, society, and economy. Climate-related emergencies such as extreme weather conditions are increasing, which tend to hit women and girls harder because of gender discrimination and harmful social norms. In the aftermath of a disaster, there is a risk that girls are pulled from school to take care of the household, and when there is food stress or water shortage, people will marry younger, with a higher percentage of girls ending up in early, forced, and child marriages. Rural women and girls who are usually given the task of fetching water have to travel further to collect it, increasing their already heavy workload and putting them at greater risk of gender-based violence. Healthcare is disrupted by erratic weather, eroding the advancement of sexual and reproductive health and rights, making women and girls more vulnerable to the impacts of the climate crisis. Sexual and reproductive health and rights play a crucial role in improving well-being, overcoming marginalization, and advancing gender equality. When women and girls have access to sexual and reproductive health and rights, they have control over their bodies, and they can address unfair power relations in their lives and lead the response to the climate crisis. If we want to achieve climate justice, sexual and reproductive health and rights and gender equality have to be prioritized. Like, comment, and share if you agree.
My name is Phyllis Wabwire. I coordinate the Holistic Action Project for Adolescents. I'm based in Kitale office working for DSW Kenya. Holistic Action Project for Adolescents is all about empowering the young adolescents. And the main goal is to reach 7,000 young adolescent boys and girls aged 10 to 14 in Kilifi and West Pokot counties. Some projects that were adversely affected by the pandemic, and we had to change some strategies. We had to adapt to the situation just to ensure that we rolled our work. So we had to become more innovative, especially when providing information to the young people. Initially, we could hold meetings with the young people, but currently we are opting for virtual meetings. We are having the use of social media, the Facebook chats, Twitter storms and all that, just to ensure that the limitation in number does not hinder us from doing our work. We really want young people to access the sexual reproductive health services. We still work with the facilities to ensure that the services are available, the supplies are available, and the youth-friendly services are provided to the young people. Yeah, so in as much as access to services was affected, it's something that we still reach out to the young people, encouraging them to access the services, and also using our youth-friendly services where young people can freely access and get the services that they need. Yeah, but generally, COVID-19 pandemic really affected our work.
Ladies and gentlemen, welcome back after that short break. Wherever you're watching us from, kindly feel most welcome and follow the conversation. Remember, this discussion is sponsored by partners that have been elected above. We have Declares Kenya, we have DSW Kenya, among others. Maybe before we proceed, I'm going to sample some few of your comments that you have sent across. Again, we have Tristan Kevin who say is watching. Thank you and welcome. We have Matthias Gibet. Thank you and welcome. We have Paris who's saying MH Day is a key component of all girls. Thank you so much for that, Paris. We have Masika Mwinyi who is saying menstruation is not a problem, poor menstrual hygiene is. Thank you so much for that, Masika Mwinyi. Wherever you're watching us from, kindly, you can just drop out your comments and you're going to sample them as we continue with the discussions. If I pick up from where we left it from, I'll go back to Emmanuel Ngolepus, that is a youth champion. Yeah, I had asked you earlier in your comment, you mentioned something about tackling stigma. So if you can give us, or rather you can elaborate further on some of other issue surrounding menstrual hygiene that still exists in our environment, or rather in our space. Thank you.
Thank you. Apart from girls facing that stigma from the society, we also have high prices. Those sanitary pads are going for a very high price. When you go to a shop and ask for a packet of a sanitary pad, it will go for almost 100 shillings. That's a very huge amount of money concerning our economy at the moment, and also how people in maybe this region are living. Some people are living in abject poverty, so it makes them very difficult to get access to the sanitary pads. Also, we have access to maybe clean water and toilet. We say, in the world, they say that in every single day, 300 million women, girls and women are in their menstrual period. So, and 70 million of them are not accessing to a clean toilet or maybe good supply of water. That has led many girls maybe to stay at home when they are supposed to be in school, and also face very huge challenges when they are in their period. So it has been it's like a nightmare to many African girls to be in your period. But if we can come together as society and decision makers, we can ensure that we form policies that will even make those sanitary pads free to our girls and our women. Thank you.
Thank you so much for that, Mr. Emmanuel Ngolepus. I know you have given us some insights on other issue that still exists in our society under the issue of menstrual hygiene. And you have mentioned something key on the issue of high prices of the sanitary pads. I understand one of the reasons why our girls even don't go to school is because they lack that pad. I know our mentor is here. She can give us more insight on some of the issues that girls are still subjected to even in this era concerning the menses. Something, yeah, maybe our mentor Miriam, maybe you can elaborate for us further. Which are some of the other issues that still exist?
Okay. Thank you. What I can say currently is the emerging challenge that we need to face that has come because of the COVID-19 pandemic is the economic stress that families have to go through to make ends meet. So because of this, women and girls are at a disadvantage because already there is stress of, of economical stress, and then now girls are here and women who need a consistent supply of sanitary towel every month. So this makes them vulnerable even to gender-based violence and inequality, because most girls during this time, if they don't access sanitary towel, this makes them, even other girls, skip school or rather drop out of school. Another challenge that we girls experience is we have the cultural and cultural taboos and norms that still exist in our community. So we need to break the silence and we need to break the taboos so that girls experience menstruation with dignity. Another challenge is that menstruation has not been really incorporated in our schools. We talk this as it's not incorporated directly in our learning sessions in school. That is a big challenge because it makes these girls who are at MENAC, they don't know what they are experiencing. Some can even drop out of school, some can commit suicide, some can even get misleading information about menstruation. So we urge the government through the Ministry of Education to make menstrual hygiene management an incorporated thing in our schools. Thank you.
Yeah, thank you so much for that, Miriam. Indeed, we need to break the silence. I know you have highlighted some of the key, or rather some of the affecting issue that is really affecting our girls in terms of having a favorable environment for them to undergo their menses. And I try to link it with what Mr. Emmanuel Ngolepo said earlier, the issue of 300 million women in the world undergoing menses in a day. I understand it's a natural process and it doesn't need to come with any shame. Yeah, and I know you have highlighted some of the key issue, the issue of COVID-19, relating it to the price of the commodities. You have talking about the issue of incorporation of menstrual hygiene to school health clubs, or rather to the schools. And I know some of this question will be addressed in our second panel. And then in our second panel, we're going to have representation of the Ministry of Education, among other ministries, who are going to help us on to see how best we can come, or rather we can tackle this challenge. Let me come to you back, Mr. Young Man, Mbarak. Mbarak, if I may ask you, what challenges do you feel still exist on the issue surrounding menstrual health, hygiene management? I know you're a student, you study with your sisters, you study with our sisters, and I know you're in a position to support challenges, or rather uko kwa ile position ya kuangalia zile challenge ambayo ina affect madada zetu on the issue surrounding their menses. Which issue do you feel ina still exist ina prevent our girls to access, or rather to undergo their menses the way ina supposed to with dignity? Yeah.
Enye naweza sema challenge bado sahii ina exist ni tuseme lack of sanitary pads. Sahii hiyo pads zinapewana kwa shule ndio, lakini sometimes kuna sometimes zinaweza kuja less, ama wakati shule imefungwa girls wanaenda nyumbani wanateseka huko sawa, wamezoea ya kuaccess hiyo wanapatanga kwa shule. Sasa ukienda huko nyumbani hiyo pad sasa ni bei kali, kwa ukienda kwa duka sahii utapata pad tuseme ni 50 and above kuendelea, na msichana kitambo aende access hiyo pad itakuwa inamletea challenge kwake, na hata akikosa hiyo pad itakuwa pia ana engage kwa early sex ndo aweze kupata hiyo charge. Na hiyo kwa sahi kwa Kenya early marriage ni mbaya. Sasa akiengage kwa early sex hiyo inaleta challenge kwa wasichana na inaongeza challenge ya school dropout, kwa wasichana wakipata mimba mtu hawezi rudi shule, ataona ni kama atachekelewa na wanafunzi wenzake, ama atajiona yeye mwenyewe ataona ataendaje shule na ako na mtoto. Ama hiyo ndo baadhi ya challenge. Na ingine lack of menstrual hygiene facilities in schools. Example toilets, kuna shule zingine toilets ni chache, na msichana unajua anafaa privacy ya kwenda kuchange hiyo pads ya wakati amesoil, na wakati akisoil pia hiyo anafaa privacy. Hasa toilet wanafaa ongeze mingi.
Thank you so much for that, Mbarak. Ingekuwa class ungekuwa mpigiwa makofi 7 ikifuatana. I know you have brought us some key issues that really, because I know you're a student, you share these facilities with our girls, and you have highlighted one of the key issues in that in our schools we lack that privacy. And I know privacy is one of the factors that is really affecting the whole component of MHM. Maybe due to time, I'll go back to my good friend, Mr. Ruata. Yeah, maybe for you guys as a ministry, which challenges do you feel still exist so that you can wind up?
Thank you, our viewers. What we are experiencing is when our girls and young women, they are in that position of that menstrual hygiene day. So you find when we go there to see even there in schools, you find that the population in a school gone down. a girl has gone for medical checkup, but for such checkup, they find a lot of challenges just on the road. Our colleague has said that when they are just on the way, they may experience a lot of external forces. Maybe they'll find even some boys on the road.
Actually manageable to ensure that our community and the people that we serve are also able to actually look at what we are doing, whether COVID is there or not there. Also take this opportunity to thank you, Madam ACC, for participating in the panel. Thank you, Madam Kwaso, for being there. These gentlemen, the programs officer at CICR, basically, thank you very much for you guys taking your time and actually consolidating all this information that basically is going to chart a way forward for us as a community and as a nation, basically to ensure that our girls' lives will improve. Thank you very much, Clement Lokoma, or MC Lament, basically for spearheading the first panelist. And thank you very much for the panelists who were there. Thank you very much for all those who are behind the scenes, those who ensured that camera iko sawa. Musil, thank you very much. Bobby Pale, Shedi Pale, thank you very much. Kaisam, Papi, Peris, and those other young people who are out there, and basically you're doing the conversation right, ensuring that we start and chart the conversation forward as young people. Thank you very much. And until Tarenane, don't go away, because the Claire's TV, the Smart Teen Talk Show episode of June is going to come Tarenane, because we're going to bring also the Day of an African Child very live to you, so that the conversation cannot stop, because we're all working to ensure that our children are safe and our community is okay. So from me, I've been your host, that guy, Jeff. Until tarehe 8 mwezi wa sita, I say bye-bye. So have a lovely weekend and enjoy yourselves. Thank you very much, and God bless you.